This is how we do it.
Range of motion is the maximum amount of movement available at the joint and one of the three planes of the body: sagittal, frontal, or transverse. Sagittal is the line that passes through the body from front to back, dividing the body into a left and a right side. Frontal passes through the body from side to side, dividing the body into front and back. Transverse is a horizontal line that divides the body into upper and lower portions. Types of range of motion exercises. Active. The client moves all joints through their ROM unassisted. Passive. The client is unable to move independently and the nurse moves each joint through its ROM. And lastly, somewhere in between.
Hi, I'm Sarah. I'm going to be your student nurse today. I'm going to be doing range of motion for your shoulders and your neck. Feel free to tell me at any moment if you feel any pain or any limitations. If I'm moving too fast, we can slow down and we can change the movement around for you, okay?
Okay.
A flexion contracture of the neck is a serious disability because the client's neck is permanently flexed with the chin close to or actually touching with the chest. Neck flexion is when you bring your chin down to rest on your chest. Extension is returning the head to the erect position looking forward. Hyperextension is bending your head back as far as possible and then return it back to its regular position. Lateral flexion is tilting the head as far as possible toward the right and left shoulder. So try and touch your ear to your shoulder without moving your shoulders up or down. Right and left rotation of the neck is turning the head as far as possible in circular rotation movement. Okay. And the shoulder. One feature of the shoulder that sets it apart from other joints in the body is that the strongest muscle controlling it, the deltoid, is in complete elongation in the normal position. No other muscle exerts its full strength when in complete elongation. To flex your shoulders, please stand up. Raise your arm from the side position forward to the position above your head. And then extension is returning your arm to the normal position at the side. Hyperextension is moving the arm behind the body, keeping the elbow straight, and return back. Vertical abduction is raise the arm to the side position above your head with the palm away from your head. And then vertical adduction is returning it and then going forward. Okay, and then internal rotation is with your elbow flexed. Rotate your shoulder by moving your arm until your thumb is turned inward. And then external rotation is moving it backward. Okay? Circumduction is moving your arm in a full circle. Exactly. Elbow flexion is bending it slowly so that the arm moves towards the shoulder joint and the hand is level. And elbow extension is straightening the elbow by lowering the hand.
Hi, my name is Caroline. I'll be your student nurse today. We're going to be doing range of motion on your forearm and wrist. At any point, let me know if you have any discomfort or pain or if you have any questions. Okay? Forearm. Most functions of the hand are best carried out with the forearm in moderate pronation. So for supination, turn the lower arm and hand so that the palm is up. For pronation, turn lower arm so that the palm is down. Next, we're going to do the wrist. The primary function of the wrist is to place the hand in slight dorsiflexion, the position of functioning. So first we're going to do flexion, move palm toward inner aspect of forearm. Extension, move fingers and hand posterior to midline. And hyperextension, bring dorsal surface of the hand as far back as possible. Abduction, place hand with palm down and extend wrist laterally toward fifth finger. And abduction, place hand with palm down and extend wrist medially towards thumb.
Hi, my name is Nicole. I'm going to be your student nurse. I'm here to do a range of motion assessment on your fingers, your hips, and your knees. Okay?
And let me know if you feel any pain or discomfort while I'm assessing you. Okay?
Calming the fingers and thumb enables the client to perform ADLs and activities requiring fine motor skills such as carpentry, needlework, drawing, and painting. So first we're going to start with making a fist. This is flexion, and extension is straightening out the fingers. Hyperextension, bend the fingers back. And abduction is spread the fingers apart. And adduction is bring them back together. So now the thumb. Flexion is move thumb across palmar surface of the hand. Extension is move thumb straight away from the hand. Abduction, extend thumb laterally. And adduction is move thumb back toward. Opposition, touch thumb to each finger of the same hand.
Flexion, move leg forward and up. Extension, move back beside other leg. Hyperextension, move leg behind body. Abduction, move leg laterally away from body. Adduction, move leg back toward medial position. Internal rotation, turn foot toward other leg. External rotation, turn foot and leg away from other leg. Knee. Flexion, bring heel back toward back of thigh. Extension, return leg to floor. Circumduction, put leg in a circle.
Hi, my name is Shanel. I'm going to be your student nurse today. I'm going to be doing range of motion on your ankle and toes, and if at any time you feel any pain, discomfort, or if you have any questions, please let me know. Okay? Without full range of motion of the ankle, there will be gait deviations. If the joint is not stable, the person will fall. So for the ankle, first we're going to do dorsiflexion. Move the foot so that the toes are pointed upward. Okay. For plantar flexion, move foot so that the toes are pointed downward. And then for circumduction, circular movement of the ankle. Okay. Now for the toes. Excessive flexion of the toes results in clawing. When there is a permanent deformity, the foot is unable to rest flat on the floor and the client is unable to walk properly. So first for the toes, we're going to do flexion, curl toes downward. Then for extension, straighten the toes. For abduction, spread the toes apart. And for adduction, bring the toes together.
Just a few things to keep in mind.
Always make sure of client safety, clear the room of any obstacles, and take into consideration any physical impairments, age, and levels of discomfort.
Make sure client is always in correct position and always assess for pain prior to exercise.
Make sure to document all exercises performed. If the client had any stiffness or limitation, pain, swelling, or unequal movement.
This is how we did it.
Range of motion.